Hello, everybody. Our speaker today is Dr. Jessalynn Adam, a fellowship-trained, non-operative sports medicine specialist. She is a team physician at the high school level as well as at the professional level for the Washington Commanders and U.S. figure skating. She is double board certified in physiatry and sports medicine and practices at the Alexandria and Fair Oaks offices in Northern Virginia. Dr. Adam?
Hi, everyone. Thanks for tuning in this afternoon. I'm going to chat about ultrasound in the office. So as Margaret mentioned, I am board certified in sports medicine, and in part of that training, I learned musculoskeletal ultrasound. So most of us have some familiarity with ultrasound, and I'm hopefully going to show you a few different ways that ultrasound can be beneficial from an orthopedic standpoint. Next slide. So ultrasound is a low-cost, non-invasive way of giving us a diagnosis or more information. It can also be used to help with procedures. So your doctor might suggest doing an injection or procedure with ultrasound guidance. So I have a few slides here just to give you an idea of what that might look like and what the pictures may look like. And then I thought we would take some time and we can scan me so you can see some of the benefits of ultrasound. Next slide. So this is a list. It's not exhaustive by any means, but for some uses for ultrasound in evaluating shoulder pain. So if you've heard of frozen shoulder or rotator cuff problems, ultrasound is a really nice option to evaluate both of these, and you may even be able to avoid an MRI. Next slide. So this is just one example. It's a slide looking at the nerve that runs through the back of the shoulder blade. And if you go to the next slide, this is what that looks like on both an MRI and the ultrasound. So they each give us different information. The nice thing is the ultrasound can be performed at the same time that you see me in the office, and you don't need to make a separate appointment. Next slide. So for the elbow, there are lots of things that we can see. We can look at the nerves that run around the elbow. We can also look at that UCL ligament. So it's very famous for the Tommy John surgery and things like that. If you think you tore a muscle or a tendon, all of that can be evaluated with the ultrasound. And I actually really like ultrasound for my young pediatric patients. Sometimes we can use that to evaluate for a broken bone and avoid doing additional x-rays. Next slide. So here's just a slide showing you some of the anatomy of the elbow. And if you go to the next slide, you can see both the muscles as well as some of the nerves that we can look at here. And next slide. And so this is what that ultrasound image looks like of the outside of the elbow. So ultrasound is like a box of crayons, but all of them are shades of gray. And so based on the structure of the tissue, the structure will appear brighter or darker depending. Go ahead, next slide. And lastly, for the lower extremity, there are lots of things that we can look at. So I use ultrasound quite a bit for doing injections of the hip joint. The hip joint is a very deep joint, and you have some important nerves and arteries that run nearby. And so having image guidance to ensure we put the medicine in the correct spot is very important. All right, so shall we get to it? This machine is a portable ultrasound. Ultrasound does not hurt. We use this gel to allow the ultrasounds to pass through and give us an image. So I'm going to start by evaluating my wrist here, and I'll point out a couple of things. So you can see that gray on the screen, and right in the center there is my nerve. So if you've ever heard of carpal tunnel syndrome, this is the nerve that's affected there. And I'm going to show you something really cool, which is that if I move my fingers here, you should see all of the tendons blinking. So one of the really nice things about ultrasound, and I'd say a big advantage, is that we can look at things dynamically. So For an MRI or an X-ray, you are staying still, but for an ultrasound, we can watch how things move. So if I move down to my finger here, say for instance, you're not sure if you injured your finger, you can actually see those tendons moving back and forth. And I can follow them all along their whole length to make sure that they are still connected and attached. There are no tears, fluid around the tendons or other abnormalities. At the bottom of the screen here, you can see that really bright surface. That's actually the bone. And you can see right here in the center of my screen now is actually the joint. And then if I move my finger back and forth, those are my finger flexor tendons. So some of the things you might be able to see here are tendon disorders. You can see foreign bodies. So if you've ever gotten a splinter in your finger or something like that, ultrasound is great for picking this up. And some things may not show up on an X-ray. And oftentimes an MRI is somewhat overkill for a foreign body. So ultrasound is a quick and easy way to find it and locate it. All right, so we can, if you have any questions, I'm happy to talk more about ultrasound, and maybe the next time you come in to see the doctor, you may find an ultrasound beneficial for you.
Thank you, Dr. Adam. We do have questions coming in. So the first one is ultrasound covered by insurance?
Yes, it is. So ultrasound does go through your insurance. Typically for what I call a diagnostic evaluation, it's not something that you would need a prior authorization. However, if ultrasound is being used to guide a procedure, that may require an authorization.
What do you mean by having the ultrasound guide a procedure?
So in orthopedics, we do a lot of injections. These might be steroid injections, platelet-rich plasma, or various other procedures. And so say you needed a cortisone injection in the hip. In order to make sure that the needle is going to the right location safely, I can use the ultrasound to guide the needle. So it's as the needle is being inserted and directed towards the hip joint, I can track its progress all live, real time.
Thank you. What about on the spine? Can you use ultrasound on the spine or do any procedures that help with low back pain?
It depends. So there are certain procedures where fluoroscopy or using live X-ray is more beneficial. So procedures where you're going in and around the nerves, fluoroscopy may be better. But if you're looking to do things like a trigger point injection where you're just injecting the muscle around the spine, yes, absolutely.
Thank you. What was the thing that you were using on your skin, the white thing? What is that called? And are there different types of them?
Yes, so this is an ultrasound probe. This one is affectionately named the hockey stick. And they all have different frequencies. So ultrasound is sound waves. And basically the image is made by those waves coming back to the probe. So depending on the probe that I use, my image will change. So this is what we call a high frequency probe. And so you can see the superficial tissues in really high resolution. Now, if I were to say, use this curved probe on my finger here, let me switch over here. The resolution will be less, but the advantage is I can see much deeper structures. So you can see that same picture of my finger is just not quite the same quality. But if I needed to look deeper, I can actually see all the way through to the other side of my wrist, which is not something that I would be able to do with the other probe. So this curved probe is what we call an abdominal probe or a curved probe. When I do injections of the hip joint, I use this probe. If I'm looking at the hand, fingers, foot, or toes, I use the little guy. And for joints that are medium in size or structures that are not quite as deep, I use what we call our linear probe, which is this one, and it's intermediate between the two. So for example, if I'm evaluating the structures of the knee, different ligaments, or looking for fluid inside the knee, or even using this to drain fluid off of the knee, I would use this probe here.
Thank you. So if somebody is having pain, but everything looks okay on an X-ray on their joint, would ultrasound be a good next step?
Absolutely. I love to put the ultrasound where it hurts, and you'd be surprised what you'll find. So ultrasound gives you different information than an X-ray. An X-ray is really great at looking at bones, and that's probably where ultrasound is the weakest. So the sound waves do not pass through the bone. So ultrasound can provide different information, and I've found all sorts of things that way.
Thank you. Is there any hurt or discomfort from the ultrasound?
No, generally not. If, for instance, I've scanned over an area maybe where someone had a cut and we need to evaluate if the tendon is intact. And so there may be some discomfort if I'm pushing over an injured area, but I try to be as gentle as possible. And for the most part, it is relatively painless.
Thank you. How much pressure do you have to use?
Very light. So in fact, if it's a really sensitive area, there are all sorts of techniques that I have to even avoid putting pressure on altogether. So I can use extra gel and make it really thick so that I'm not pressing on the surface. So this is, let me switch back here again. So I have very, very minimal pressure. I can barely even feel the weight of the probe. And you can see I've got a pretty fantastic image there. The other option is if I need to not touch the area altogether, I can submerge the body part in a basin of water and use the water to transmit the sound waves instead of the gel. And I have done that before. So it should be very light. It really should not cause any pain, and should provide some really good information.
Thank you. Does the ultrasound actually treat an area, or is it just diagnostic?
So the type of ultrasound that I'm referring to and that I use is a diagnostic modality. It is not a therapeutic ultrasound. The only time it becomes therapeutic is when it's guiding a needle.
Thank you. Can you get an ultrasound if you have metal in your body?
Absolutely. In fact, ultrasound may be more advantageous than some other imaging in that scenario because, for instance, an MRI, you'll see a lot of metal artifact, and there are ways to reduce that, but ultrasound can complement that nicely. So for instance, say you have hardware in some part of your body and we're trying to evaluate if that's causing pain or discomfort or irritating the surrounding tissues. Ultrasound is a really nice option to look at that area.
Thank you. If you do an ultrasound and something looks inflamed, what's the next step?
So it depends. It could be as simple as taking some anti-inflammatories or using some anti-inflammatory cream. In some cases, other interventions like an injection may be warranted or helpful, and always some physical therapy.
Thank you. What can the ultrasound detect in the rotator cuff area?
So the ultrasound can do a fairly comprehensive evaluation of the shoulder. I routinely look at the biceps tendon, both joints of the shoulder, as well as all four of the rotator cuff muscles and tendons at their attachments. I can even see parts of the labrum and some of the ligaments that can be involved in a frozen shoulder. So provided the person is able to move their arm, I can evaluate all of those very well. And ultrasound has great resolution for picking up things like rotator cuff tears or biceps tendon injuries.
Thank you. Is ultrasound useful for diagnosing neuropathy or other nerve issues?
It can be. Neuropathy is something where you often need multiple tests to evaluate. And so I think ultrasound can be part of that evaluation. There are other tests like nerve tests and EMGs that can be really beneficial. So I always use the analogy, ultrasound is like back in the day when phones would be on the hook or off the hook. An ultrasound or an MRI can tell you if the phone is on the hook, and something like a nerve test or an EMG can tell you if it's ringing. So I do look at the nerve. There are signs that I can see that the nerve is unhappy. So if it looks entrapped in scar tissue, if it's swollen, enlarged, if it's getting pinched, those are signs that tell me that maybe getting a nerve test would be a good idea.
Thank you. Can you diagnose pain around knee and hip replacements with an ultrasound?
It depends. So ultrasound can be part of that workup. Often there are many tests that may need to be ordered to thoroughly evaluate that problem. But certainly if there's any concern for a fluid collection, then ultrasound can be helpful to look at that, or if there's concern for a muscle tear. If it's something having to do with the hardware or inside the joints, then often you do need some other tests, perhaps some blood work, or sometimes even an MRI as well.
Thank you. Does it require a referral?
No, it does not. So the ultrasound comes with me every day to my office and into almost every room with me. And if it's a problem where I think ultrasound would be beneficial, then I discuss that and we do the ultrasound right then and there.
Thank you. Do other doctors at OrthoVirginia use ultrasound?
Yes, so there are 3 other non-operative providers like myself, and we each perform diagnostic and ultrasound guided injections.
And there are additional providers in other parts of Virginia as well.
Yes.
Thank you so much, Dr. Adam. Would you like to close?
Sure. Thank you all for spending your lunch with me here. Hopefully this was interesting and you learned a little bit about ultrasound. And next time you see your doctor, maybe ask if it's something that would be beneficial for you.